Conception begins with a fertilized egg. Normally, the fertilized egg attaches to the lining of the uterus. An ectopic pregnancy occurs when a fertilized egg implants and grows outside the main cavity of the uterus. It's common in the fallopian tubes, which moves eggs from ovaries to the uterus. This is known as tubal pregnancy. Sometimes it can happen in the ovaries and cervix. As the fertilized egg grows, it can rupture and can cause life-threatening bleeding. If this happens, you will need medical care right away. If you don't treat it, it can be fatal. Signs of an ectopic pregnancy include abdominal upset and vomiting, sharp tummy cramps, one-sided body pain, fatigue or dizziness, pain in your shoulder, neck, or rectum. Signs of a ruptured ectopic pregnancy. An ectopic pregnancy can cause your fallopian tube to burst. Emergency symptoms include major pain, with or without heavy bleeding. Call your doctor right away if you have heavy vaginal bleeding with lightheadedness, fainting, or shoulder pain, or if you have severe tummy pain, specifically on one side. What causes an ectopic pregnancy? In most instances, conditions that impair or block the movement of the egg down your fallopian tube cause ectopic pregnancy. This could happen due to presence of scar tissue, adhesions, or inflammation from a prior pelvic surgery, damaged fallopian tube, such as from a sexually transmitted infection (STI), congenital anomalies like having irregularly shaped fallopian tube, having a growth blocking your fallopian tube. Risk factors for ectopic pregnancy: a previous ectopic pregnancy, a history of pelvic inflammatory disease (PID), an infection that can cause scar tissue to form in your fallopian tubes, uterus, ovaries, and cervix, surgery on your fallopian tubes including tubal ligation, or on the other organs of your pelvic area, a history of infertility, treatment for infertility with in vitro fertilization (IVF), endometriosis, sexually transmitted infection (STIS), an IUD in place at the time of conception, a history of smoking tobacco. If you realize that you're pregnant and have an IUD intrauterine device in place, or have a history of a tubal ligation having your tubes tied, contact your healthcare provider right away. Ectopic pregnancy is more common in these situations. Your risk can also increase with age. People over age 35 have a higher risk than people under 35. Surgical treatment for EP. Your provider will want to remove the ectopic pregnancy with surgery. If your fallopian tube has ruptured or if you're at risk of rupture, this is an emergency surgery and a life-saving treatment. The procedure is typically done laparoscopically through several small incisions in your abdomen. Surgery for ectopic pregnancy.